here. So as I did mention, we are in Badgers Minding the Gap Year, Careers in Healthcare. And just want to welcome you again. We are so glad that you're here today. So my name is Sarah Hallis, and I'm the Experiential Education Coordinator here at SuccessWorks. And in my role, I essentially help to plan and organize virtual treks, as well as when the time comes, in-person treks, case studies and mock interviews and other opportunities for students to really dive in and have a hands-on experience related to career development. So thank you for being here today. And I'm going to turn it over to Maureen to introduce herself.
Hey everyone, welcome. I am a career and internship specialist for health, environment, and research related careers. And I see some familiar names in the participant list, so welcome. Good to have you here. So I do advising within these career community areas. That was also in the poll question, hence why I'm with this group today. I wanted to give a shout out to the Health Professions Expo and the Center for Pre-Health Advising. If you haven't already had a chance to explore the expo, one of the first links that was shared in the chat will take you to that page so you can register and explore virtual resources, other health programs, more live events that are happening this week, including this event. So, and good to have you all here.
Thanks, Maureen. And students, if you could just please take a moment to share in the chat what you're majoring in or considering majoring in. I think that would be also wonderful information to for our presenters to take a look at. So take a moment to do that when you can. The other SuccessWorks staff who are involved today, you'll have the chance to meet them when we break out into small groups in a little while. So thank you. All right, so we are going to go on to the next slide here. I do want to have us take a moment to acknowledge the land that we are on. And if you could take a moment to acknowledge the land you are on wherever you are. The University of Wisconsin-Madison occupies ancestral Ho-Chunk land, a place their nation has called Dejope since time immemorial. In an 1832 treaty, the Ho-Chunk were forced to cede this territory. Decades of ethnic cleansing followed when both the federal and state government repeatedly but unsuccessfully sought to forcibly remove the Ho-Chunk from Wisconsin. This history of colonization informs our shared future of collaboration and innovation. Today, UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. We also want to take a moment to thank our presenters. We are really excited to have them with us today. We know that's why you're here, and we want to acknowledge them. You can learn more about the presenters who are participating. There's a link coming through the chat with information about them and LinkedIn connections and all that. And then also we are sharing with you information about the preparation packet, information that you had received from us in advance via email. So if you didn't get a chance to look at that, no worries. Take a moment now to open that and just have that as a reference for yourself in the future. And if you do have any technical or program-related questions during the activity, you can send a message to any of the co-hosts and we can help you. I'm going to turn it over to Maureen now to go through a Zoom intro. Some of you may be quite familiar, but if you aren't, this will be a nice refresher.
So thanks to everyone who has their camera on, and if for every reason you don't want it on, that is fine too. We're going to have a chance for Q&A. If you want to turn your camera on and unmute, raise your hand. You can, of course, include questions in the chat box. When we do get into breakout rooms for the last part, you'll be able to see in the right corner, when you hover your mouse, you'll be able to see where you can click to join those rooms. And everyone will be able to screen share if they have resources, especially our presenters. You'll also see where to stop screen sharing after you've started that. And then if you have any files you want to share, you'll be able to click on the file in the chat box to upload any documents that might be useful. Next slide. All right, so just a rundown of our time today together. We are going to start our presenter introduction soon, and we'll take questions when each person is done sharing their experience and their program that they're representing. Once we get into small groups, everyone will have a chance to introduce themselves, and you'll get to meet other SuccessWorks staff that will be helping out. And then we'll go into small group activities and Q&A. We'll finish in our small groups, so you won't have to come back to the main room. Next slide, Sarah. When we do join rooms, these will be the choices that you'll have. So you'll be able to see these and click on join. We'll go over those directions again. And with that, we will begin to share more with hearing from our presenters. So Sarah, I will hand it over to you and we'll get started.
All right, thank you so much, Maureen. Appreciate your help there. So we are going to get started with our panelists, and we're going to ask them to each introduce themselves and their organization or program that they're representing today. If our panelists do have any visual materials that they would like to share with us, as we've mentioned, we do have screen share enabled, and that will also be available when you all go to small groups. So you can also feel free, panelists, to include any websites in the chat that you might want to reference or encourage students to check out. So we're going to actually start with Tina Lauren, and hopefully, Tina, I'm pronouncing your last name correctly. Feel free to correct if need be. And Tina is joining us today as a presenter, and Kate Schachter, not sure which one, will be a part of the small group breakout session that's happening later. And Kate is also connected with the Peace Corps. So panelists, the 4 questions that we're going to ask you to speak briefly on, and we are putting these in the chat, are: tell us a little bit about your professional journey and your current role. Tell us about the gap year program or opportunity you're representing today. How did you get the program or opportunity you're talking about today? And what's your best advice about how to get into this program or opportunity? So Tina, we'll turn it over to you, and thank you very much for going first.
Sure, thank you. And it's so nice to be here with everybody. And thank you very much for the poll. It's helpful to see where people are coming from. I was actually a UW-Madison undergrad. I graduated in 1995 or 6. I actually can't remember. I guess it was 1995, so quite a while ago. And I saw somebody in the chat was a nutritional science major. I started out as a nutritional science major, and at about halfway through my undergrad, realized that I wanted to do an international career. And I didn't know if that was actually going to get me to where I wanted to go. So I switched into education for various reasons and figured out after I had graduated that you can do a career in international nutrition, and that's what I do now. So just to answer the first question on my professional journey and what I do now. So I'm in international public health, nutrition specifically, and I'm based in the United States right now, but I have been based overseas, and most of my 20 plus years of career have been focused on overseas low and middle income countries. including living in overseas countries. And my first introduction into that was through the Peace Corps, which is what Kate and I are going to be talking to you about today. So again, I knew that I wanted to go international, but I wasn't quite sure what I should do. I smiled when I saw that poll question of, what do you do after undergrad? I was in the same boat, and I grabbed onto the Peace Corps because it was an established program. It was a very supported program, meaning, they were going to take you there, take care of you to the degree that you need to be taken care of, which is pretty hands-off when it comes to the Peace Corps. But that's actually what I wanted. I wanted that experience. I wanted to go as rural and as off-grid as I possibly could. And so Peace Corps was a really good way to do that. At the time, I said I didn't have a preference for where they sent me, and I ended up going to Kenya. And because I graduated with a degree in education, I was sent to be an English teacher. So I taught in Kenya in a rural village for 2 years. And it was, as I look back on my career, it was definitely the most formative part of my professional career, even with my overseas travels and living abroad, and all the other experiences that I've had. And I honestly cannot imagine my perspective on doing my work that I do today without having had that Peace Corps experience. In fact, it was great to see that land acknowledgement in the beginning and sort of an acknowledgement of the colonization, because within the industry that I'm in, we're having a lot of discussions on that, a lot of discussions on where the power lies and who's making the decisions, because a lot of the money comes from high-income countries like the United States. So who's making decisions on who receives the money and what we do with the money? It's largely been generated out of the United States, and there's a big push to push that more towards the countries and having countries have more of a voice in that. And, sitting at the table with lots of other people who are thinking about this and trying to sort of guide the global conversation, I really draw on that Peace Corps experience that I had, living and breathing with my country counterparts for those 2 years with very little resources that I would have had perhaps in other contexts or in other programs. So so you could tell that I'm a very pro Peace Corps, I had a great experience. Hindsight is, I don't know if it's 2020, but I probably have forgotten about all the hardships and how difficult everything was, but my experience was overwhelmingly positive. And I'm still in touch with a lot of people from that aspect of my life. Now we're on Facebook and WhatsApp, and I'm still in touch that way. So I'm just looking at the questions here. I think I got into the opportunity and into the Peace Corps largely from events like this that exposed me to what the Peace Corps was. And at the time I met with the Peace Corps recruiter, which of course is Kate. And I think after I heard about different experiences from the recruiter, I just knew that that was what I wanted to do. And again, I think one thing that, at least for me at the time, and it seems like maybe for this group as well, as you think through, I'm not sure what I want to do next, because it was a fixed time period. It was 2 years and 3 months because of the training, 2 years and 3 months. And it had structure. For me, that was what I wanted to do. I knew other people who did international careers that said, I'm just going to go travel around the world by myself for a year. I needed a little bit more structure than that. That's just kind of the person that I am. And I was able to find that within the Peace Corps. And so my best advice for getting into this kind of program, I don't know how much the recruitment has changed, and I think Kate can talk about that. But throw your name in the hat. I mean, I don't know. I felt like by applying and having to go through the process, I became more aware of what I was applying for. And so I guess I would just say, go through the application process And just a final thing that I'll say, in case anyone is thinking about getting into international nutrition, please feel free to get in touch. Or I guess international health in general. I chose nutrition as my path, but I have plenty of colleagues who chose HIV or infectious diseases, you know, childhood illnesses, et cetera, et cetera.
Thank you so much, Tina. Really appreciated hearing from you all. And students, again, later you'll have the opportunity if you want to meet with Tina and Kate. Tina, I was in Kenya at the same time you were, but I was studying there as an undergraduate, studying abroad. So what a small world, huh?
Oh, that's so great.
We are going to move on to our next panelist here. Our next panelist comes from the Wisconsin Health Corps, and Eliza Edlund. And Eliza, my apologies if I didn't get that last name pronounced correctly. You can correct the record. Is going to be talking about opportunities with Wisconsin Health Corps care. So, sorry, Corps rather. So go ahead, Eliza.
Hello, everybody. Yes, my name is Eliza. You pronounced it correctly. And I am representing Wisconsin Health Corps today. I was supposed to have a co-panelist, but unfortunately at the last minute, she wasn't able to come. So I'll try to cover her information, but we'll see how it goes. So I'll start out by talking a little bit about my journey. It's been pretty short so far. I graduated from Luther College in Decorah, Iowa, less than a year ago, so in May. So I'm very familiar with the stress and kind of panic at times of trying to figure out what to do next after undergrad. So yes, I am working at serving through Wisconsin Health Corps at Scenic Bluffs Community Health Centers in Cashton, Wisconsin, which is about 40 minutes outside of La Crosse. It's a pretty rural health center. And if you don't mind, I'm going to try to share some information here. Let me know if you're having trouble at all seeing this. Okay.
Looks great. Looks great.
All right, good. All right, so the Wisconsin Health Corps is actually a part of Americorps. And for those of you who aren't familiar, Americorps is a national service organization with the kind of motto of getting things done for America through service. So here it says, still getting things done for America, because it's been around for a while and we just underwent a big rebranding initiative. So we're still getting things done for America. And Americorps is part of the National Community Service, or excuse me, the Corporation for National Community Service. And it has three main branches. So some people may have heard of the National Civilian Community Corps, or NCCC. Then there's state and national, which is what Wisconsin Health Corps falls underneath. And then VISTA, which is Volunteers in Service to America. And both state and national and VISTA programs have opportunities in health, but I'm going to talk specifically about Wisconsin Health Corps and the state and national program. All right, so there are some benefits to serving with Americorps overall. So first of all, you get a modest living stipend, which is usually enough to cover modest rent, food, gas, that sort of thing. And to make Americorps more affordable, they offer loan forbearance, specifically on public loans. And then after you're finished with your 1 year term, you get an educational award that is approximately $6,000 depending on the year. And then they do offer health insurance and childcare if you need it. And you can also, you're eligible for some benefits like food share through Americorps as well to try to make it more affordable for folks. All right, and then what is Wisconsin Health Corps? So the mission of Wisconsin Health Corps is increasing access to healthcare, specifically increasing equity in healthcare in Wisconsin. So here you can see a little diagram, and some of you might already be familiar with this analogy. So Wisconsin Health Corps' goal is to really provide members and resources to host sites that really need it. So I'm at, I'm at Scenic Bluffs Community Health Centers in Cashton, but there are about 14 other host sites throughout the state. And those fall into 3 categories: community health centers, public health departments, and health-based nonprofits. And in my service at Scenic Bluffs, I am really focused on community education initiatives, including community activity programs, dental outreach in schools, working with our Latino and Hispanic population to engage them in our programming. And then I've also been serving a lot with the COVID-19 response at our health center. All right, I tried to go through that quickly so that I could get to the other questions here. So I really got into the Wisconsin Health Corps because of my interest in public health and medicine. So I'm hoping in the future to attend medical school and hopefully get my master's in public health. But I really wanted to take a year to understand what a career in public health or working in a rural setting would be like. And my best advice about getting into the program is to really research your host site and research the things that you will be doing, and really latch on to some specific facts and then describe your interest and passion in those specific things during your application process. All right, thank you.
Thank you so much, Eliza. Very wonderful to hear your story and hear about your experiences with the Wisconsin Health Corps. And I imagine it's quite a year to be there, given everything that's been happening, both globally as well as and nationally, as well as statewide and locally. We are going to go next to Oak Street Health. And that's with Brittany. And Brittany, I'm not sure how to pronounce your last name, so I'm going to let you do it for fear of butchering it too much. And so Brittany, thank you so much for being with us today to talk about Oak Street Health.
Thank you. It's Dorinda. It's definitely a tough one and it's always said wrong, so no problem at all. So thank you very much for having me here today, and thank you everyone, all the students and presenters for coming. It's great to see such a nice turnout. So I'm presenting on behalf of Oak Street Health, but I graduated from uw-madison in 2018, so I think 3 years ago, yes, 3 years ago now. And I was a neurobiology and psychology major, and I also did the leadership certificate. And so I went from undergrad, and Maureen actually helped me a ton through my journey to find what I wanted to do during my gap year. And I struggled just like you guys for so long, making sure I made the right decision and with the ultimate goal of getting into medical school. And so I was really unsure with what I wanted to do. And she helped me actually find Oak Street Health, get connected with Oak Street Health, and then actually serve there for a year. And now I'm in medical school. I go to Nova Southeastern University in Tampa, Florida. So I'm a second-year medical student, and I'm also getting my master's in public health at Nova Southeastern as well. So my gap year worked out and I got into medical school. So a lot of thanks to Maureen for that, for setting me up with Oak Street Health. But during my time at Oak Street Health, I served as a medical scribe. So kind of just to jump into those questions a little bit, I told you about my professional journey and my current role as a medical student, which is a little crazy right now, coming up on board season, but it's been good. And so Oak Street Health is a primary care clinic that serves mostly Medicare, Medicaid individuals, and most of the Oak Street Healths are placed in medically underserved communities that have limited access to healthcare. So I worked primarily in Chicago. So I worked at the Edgewater Clinic, which is just north of the city. And I worked with a Spanish speaking provider. So her panel was primarily 75% Spanish speaking, I would say. And during undergrad, I had taken a couple of Spanish courses. I took Spanish in high school, and then 2 years of it. And then I studied abroad in Barcelona when I was a junior. So I had what I thought was Spanish background. And then I went to Oak Street Health, and I was introduced to the whole field of medical Spanish, which you don't learn when you're an undergrad. So that was a really great opportunity for me. I think that I gained a lot more Spanish than I was actually expecting to, which was really great. And now transitioning to medical school in South Florida, it has been an amazing opportunity for me. My school makes us take practical exams in Spanish with practice patients, and it has been so awesome being able to help out some of my colleagues actually with the medical Spanish aspect of it. So kind of circling back, as a medical scribe, I was paired with one practitioner. I was actually with a nurse practitioner. And so she spoke Spanish, and we would see probably 20 patients a day. And I would follow her and take all of her notes for her, and then put in orders, whether that be for different imaging like x-rays or MRIs or lab studies, if they had to get blood draws, anything like that. If they had to go see an outside specialist, like a gastroenterologist or neurologist, I would write referrals for them to go and see them. And then I would make a lot of follow-up calls with the patients as well, which also challenged my Spanish speaking abilities for sure. But it was a really great opportunity to make a connection with the provider in a way that I will forever cherish. We still talk frequently, and she's helped me through the process. Even though she's a nurse practitioner, we still are on the same page in terms of being professionals in the medical field. As I mentioned, it really helped my Spanish speaking abilities, and it really helped me to understand the way that a primary care clinic flows and to get the background knowledge of how medicine in general flows. If you never work in a medical office prior to kind of going into medical school or PA school, it's hard to kind of understand what role the nurse might take or what role the medical assistant might take. And so actually being submersed in that environment really helped me kind of understand the importance of all those roles and working as a team. And another really great thing that I gained from the experience was a baseline level of medical knowledge. I think we learn a decent amount in our physiology or anatomy courses, but you don't ever kind of see where the connections come in, or see what medications fit with what, or how the vital signs really matter, or actually how patients might present. So I've been able to kind of draw on some of my experiences as when I was a medical scribe during medical school. I think back to, oh yes, I'm learning about osteoarthritis, and I can think of that one patient that I had that came in and was limping and said that it got worse in the mornings but better throughout the day, and it helps me to fit a person to that diagnosis. So I think that that's been a really valuable aspect of having that and then going into medical school. And as I said, I got into the program. Maureen actually connected me to the Indeed that I was able to submit my application to for Oak Street Health. And then it's a series of interviews that you do, which I'm sure they kind of do over Zoom. We did them over the phone. I think there was like 3, and then I actually went down to the clinic in Chicago and did an in-person interview as well. And I think my best advice to anyone that would be applying for this would be to really research Oak Street Health. They have a lot of core values that they sit on, especially with the specific population that they serve. And then there's a couple of questions that they ask, I would say, typically in their interviews. So I kind of tried to think back and pulled those into our breakout discussions that we're going to have today. But they really like to see undergraduate students who just graduated, who are eager to get into the medical field, because they're the type of scribes that really thrive, because they want to learn and they really want to be in that environment. So I had an amazing year and I absolutely loved it. So thank you again, Maureen, and hopefully I will see some of you guys in the breakout session.
Thank you, Brittany.
So much, Brittany. Wonderful to hear your story and how pivotal the role of just seeking advice and guidance from Maureen played in your development of having that opportunity and gaining that experience. So thank you. Our last panelist to speak today is someone who works in a clinical care setting, and during Daniel's gap year, was serving as a medical assistant. So Daniel Beardmore is here with us today, and we'll be talking about, will be a great person for a breakout if you're just exploring and still trying to figure out what you might want to do with that gap year, if none of these particular programs are quite aligned with what you're looking at. So without further ado, Daniel, or Dan, as I see you noted here in the Zoom, we'll turn it over to you to share your story with the group. Thank you so much.
Thank you very much. Hi, everyone. Yeah, I'm Dan Beardmore, a pediatrician that works in Stoughton, or excuse me, lives in Stoughton, Wisconsin, and works in Janesville, Wisconsin, so not far from the campus. I went to undergrad at UW, lifelong Badger fan, always wanted to be a Badger. And then med school was in Chicago at the Chicago Osteopathic Medical School. So nice to see a fellow DO here, Brittany. And then tried something different and went out to the East Coast for my residency. So if anyone has questions about how the match program works down the road, if you have questions or curiosities about that, it kind of threw me into the program and spit me out into Philadelphia, which was a really fun experience in the end. Blessing in disguise to leave home for a little while, but I always knew I wanted to return. So I started looking for jobs back in the Madison area and really scored. I've been at my current position for 3.5 years, my first job out of residency. And I think it's going to be my last job out of residency. I really love it there and it's going really well. To finish up that first question about professional journey, I was hired by the site chief, a local leader at the Janesville clinic, and then he retired, which kind of thrust me into his position. And I've since kind of ran with that. I currently serve representing pediatrics and the Janesville site, the SSM Wisconsin Region Physician Advisory Council. And I am vice chief of staff at my hospital. So things happened really fast in my couple of years. So I'd love to be an advocate to talk about the importance of getting involved in leadership and administration so that you can, have a greater impact in what you do. But my gap year, I think, was also really important in my journey. To make a short story long, which is what I always do. I wanted to grow up and be the Packers team doctor someday. I grew up in Green Bay, Wisconsin. I happen to know the Packers team doctor, the guy that still runs out onto the field right now. He, I went to school with his kids. He was a neighbor. So that's how small town Green Bay is. And I figured someday I would be the guy that would fix Brett Favre's ankle. Of course, I wanted that job. I ended up taking some phenomenal advice from him. And he said, someday you're going to meet the people you want to be like, not the field you want. And what I knew I needed after I finished undergrad was some experience in the field and opportunity to add that to my resume, and found a program through SSM, which was then called Dean Clinic, called a patient care assistant. And I don't know if that program is still ongoing, but I know patient care assistants still work throughout the organization. And they basically we finished a very short, condensed form of medical assistant training and then got jobs rooming patients, taking their vital signs, asking, a short history of why they were there for their visit, maybe helping fill out pre-completed templates for their physicals or their wellness checkups. And the job openings that were available for me when I was lucky enough to get into this program were in orthopedics. Perfect, dream job, right? Going to be the next Packers physician, fix ankles, or pediatrics. And I ended up getting the job in pediatrics. And the rest is history. Because it was so much fun to work with these kids who were so excited to come in and get their sticker and see how tall they grew, check their vision and check their hearing. And I never looked back. I did pediatrics, forefront of my mind ever since. And for the gap year purposes, it did exactly what I was hoping for. I graduated in the winter of 08, a semester early, because my major changed a few times and I was able to, by circumstance, finish a little early, save a semester of tuition and get out there. So I worked for 18 months at this position. And in that time, not only got to add that to my resume, restudy for and take the MCAT that second time that was needed, but also build some amazing relationships and get letters of recommendation from doctors who are now my colleagues. Full circle back in the same organization. So to get into programs like that, other options out there would be like a scribe, like Brittany did, or to be a phlebotomist, or to be a volunteer if you can afford it at the hospital, or go through the Red Cross and get your CNA training. Those are all the things that would get you patient care experiences if you feel like that's what's lacking on your resume to get in. And the way to get into this, the advice that I have is to search far and wide and try it all, even if it doesn't seem like it's for you. My particular position in my gap year, there were 12 of us hired out of, I think, an applicant pool of 2,000. So go for it is the advice that I have, because what you're doing in your undergrad, getting great grades and studying for exams at UW is better on your resume than you probably.
Thank you so much, Dan. It's really wonderful to hear your story as well. And, a particular note was that you had a vision for what your career path was going to be, but then having that gap year experience really helped you pivot and learn about a new specialty, pediatrics, that you hadn't been thinking about. And it sounds like it had a profound influence on you that is still with you today. So
no, that's a really good word that I haven't used yet for my journey, but pivot is great. I started as a microbiology major and then learned that this upcoming needed course wasn't going to be for me. So I went to bio with honors and then learned that course, that my research project that summer wasn't working out. So then I dropped the honors in the research, graduated a semester early, pivoted, found this position. Once again, thought I was going to go on to the ortho job, got the peds job. I was going to be a Badger forever, got into different medical schools, different residencies, and then here in my job, being thrust into different positions. And again, changing my, career trajectory. That's a great word to use.
We're using that a lot this year at SuccessWorks. It seems to be the word of 2020, 2021, and probably beyond that as well. Well, wonderful. Thank you to all of our panelists for introducing yourselves. We are at 3:15. I am going to turn it over to Maureen. We do want to transition to small groups at 3:25, but that does give us a little bit of time for questions. So Maureen, take it away. We first need you to unmute yourself.
Thank you. Okay. So I have a list of questions to get us started, and I can see we've got some questions coming in as well. In thinking, let's see here. Should we start this? All right. So panelists, as the questions come in that relate to you, you can also share responses so everyone can see them in there. One question I have to start us out, thinking about the experience you had after undergrad, I feel like some of you answered this already. What is something that surprised you about that experience? Specific skills that that you learned that that you're still using? I feel like all of you answered that really well. Is there anything else that comes to mind?
I have something to add. Something that surprised me about my service with Wisconsin Health Corps was how much of an opportunity it was for taking initiative and kind of taking directions that I wanted in my service. So coming in, I had a position description, but then over time, that changed and pivoted a little bit to kind of fit my interests and my passions. And so I think that that's something really unique about service with Americorps and Health Corps is that opportunity to kind of take ownership over what you're doing, feel a sense of ownership, and yeah, have the opportunity to manage your own projects and initiatives. It's really exciting. And I think something that you sometimes don't get in undergrad that's really valuable.
Yeah, absolutely. Yeah. I have a question for Tina. So getting to teach English and just, have that international experience, and nutrition being your interest area, were you able to learn about nutrition efforts in your community? Were you able, even though teaching wasn't going to be your focus later on, do you feel like you were still able to take something from a health standpoint from your experience in Kenya?
Yeah, so at the time I didn't know, I actually, even in the Peace Corps, I didn't realize that this whole world of international public health nutrition even existed. But when I was, as a teacher, I also started a girls group, and a lot of what the girls wanted to talk about were health issues. They didn't really have a forum to talk about health issues. And it was, mostly sexual and reproductive health. Just being, we come from a culture where it's pretty open to talk about things. That wasn't a culture, it was very open to talk about those things. So I was able to do a little bit of sort of like in health, not necessarily in nutrition specifically. But one thing I feel like the Peace Corps really set me up for, and I didn't realize this going in, but I think Kate will also probably talk about this in the breakout groups, is there are doors that open up for you potentially with the Peace Corps. So there's some preference that you have with government jobs afterwards. I know some graduate schools, like I went for my master's in public health at Tulane University, really a magnet school for Peace Corps volunteers because it focuses on community-based international health. And they had scholarships for RPCVs, for return Peace Corps volunteers. And then in my business of international public health, there are lots and lots of Peace Corps volunteers. And I'm, over the years, I've been on a lot of hiring committees. And that when somebody has Peace Corps on their CV, it's just an indication of that they can hack it. You don't worry that you're going to hire somebody that then is going to get out to the countries and completely flake out. That they're going to be able to hack it. They're going to be hardworking. That they're going to be able to handle cultural contexts and cultural sensitivity and all of that. So I think it's probably opened up some doors for me that I didn't even realize when I went into the Peace Corps that it would.
Absolutely. Yeah. All right. Another question. What is a common problem or a challenge that you faced that you maybe didn't anticipate in that transition from undergrad and then getting into a professional setting. And this could be for any of you.
I could speak on that a little bit. One specific problem that I had, I think, was I know that when I was at UW-Madison, I felt that I had support in a lot of different ways, whether that be from career advisors or advisors in the letters of science, things of that sort. But then when you're during your gap year, you almost feel like you can't reach back out to those previous advisors, or who should you be reaching out to, that sort of thing. One great resource that I utilized from Oak Street Health is, and I'm not sure if she's still there, but her name was Dr. Silva, and she was actually a provider at Oak Street Health who had worked on an admissions committee for a medical school. And she would meet with the scribes at Oak Street Health or medical assistants to kind of help them build up their resumes and work on their medical school applications and proofread, whether it was personal statements or secondaries or whatever was needed. So that was a really great additional support that I wasn't expecting I was going to get. And I didn't think I really realized that I needed until I found out she was there and then started utilizing her. And it was a really great help.
It's nice to be able to have that support. So trying to figure out when you do transition to gap year students, just like what resources can you seek out, to kind of help you along in this process, depending on what you end up doing. And SuccessWorks sees grads up to 2 years after graduation. Center for Pre-Health will meet with alumni at any point. We have time for one more question before we transition. As we continue on with life in a pandemic, this one thought that comes to mind is, how has COVID changed your experience? I could use that word pivot again. How have you had to pivot in your current roles, or any changes in what your daily routine looks like?
I wasn't part of this decision by any means, but I was certainly grateful for it. I think that my organization, and probably many others, needed to make financial decisions to prevent, job loss and problems with their organization in the short term. But I was really grateful that my organization and many others made long-term decisions, thought long-term. So a lot of people furloughed instead of laying off. A lot of organizations offered a percentage of your usual salary, knowing that someday you would produce again and get that back for the organization. And that made people whole, and it kept people working, and without massive layoffs. I saw that throughout healthcare. A lot of businesses weren't able to afford that option. Travel, friends that were in the hotel industry, or I've got friends that were in travel and tourist industries. Like, those jobs weren't able to be kept, and there was no certainty that it would bounce back. But in healthcare, we knew that people would come back to the doctor's office. So I was really grateful that my organization and many other healthcare organizations did things. And that's a worthwhile consideration right now, even though you're only juniors and seniors in college. The goal is to find a career that's rewarding, but also to make a living and to support a family. And right now, that's a thought for everyone during the pandemic. So I think that the fields that you're going into, yes, we're on the tail end of this, the light's at the end of the tunnel, but you can be reassured that these are the kinds of fields where I do think that people make really good decisions to keep people whole, to keep their organizations.